Welcome to Clarion Connection. I'm Ron Wilshire, and my guest today is Dr. Thomas Radecki, psychiatrist in the Clarion area, and we wanted to talk a little bit about Suboxone today. There's been some concern in the area with a clinic, not his clinic, but a clinic opening in the Clarion area recently, and I believe your practice involves Suboxone quite a bit.
Oh yeah, so we've got offices here and over in Seneca by Oil City. We're looking at opening up an office in Kane and possibly Du Bois.
I understand Suboxone is a narcotic medication. Obviously, I'm reading this, indicated for the treatment of opiate dependence, available only by prescription and must be taken under a doctor's care as prescribed. It is illegal to sell or give away your Suboxone.
That's true. It's a class 3 narcotic. It's the powerfully addictive strong narcotics are class 2. That's the most restrictive class you can get. Suboxone is not as powerfully addictive. It's certainly much, much less dangerous. It is a very good treatment for people who become opioid dependent. Narcotic pain medicines are unfortunately the strongest, most addictive substance known to the human race, and I don't think humans should ever take it, but unfortunately doctors prescribe them far too freely.
Now, what's the difference between this and methadone?
Methadone is a class 2 narcotic. It's powerfully addictive, just like Oxycontin or heroin. Suboxone is only a partial stimulator. It only has a 60% effect, which somebody is already addicted, they don't feel it. Whereas methadone, it's a very powerful drug, very dangerous. It kills 5,000 Americans a year. By contrast, all overdoses from Suboxone and Subutex, which is a very similar medication, kill 20 people a year. So there's really no comparison. 250 times more dead people a year from methadone, despite the fact that a roughly equal number of people take each medication.
Do we find that people actually can kick heroin or whatever the opiate addiction is, or does this just replace it?
This replaces it, but and most doctors, unfortunately, don't try to wean the patients off. We do try to wean the patients off. We start that at 6 weeks. So unfortunately, it's a very slow, very long process. In mice models, there's been research suggesting that it takes the body about 15 months to totally recover from the opioid dependence.
Are you restricted in terms of the number of people you can serve in your practice?
Yeah, by federal law, each physician the first year is restricted to 30 patients. If he wishes, the second year, the doctor can ask for it to be increased to 100, and then that's the maximum ever. So I've actually gone out and recruited other doctors. I pay them very well to help us out, to help the people of this area. We got 3 that come down from Erie, 1 from Bradford, 1 all the way from New Jersey. One's going to be coming up from Harrisburg. The woman from Harrisburg, she's a pathologist, is particularly interesting. She's interested in helping out in some way with this issue, because in her son's high school, 6 young people have died in the last 6 months due to heroin overdoses.
Well, so how many doctors do you have with you?
I've got a total of 10.
10. So that's 1,000 people on Suboxone in Clarion County?
4 of those are, well, we serve a lot more than just Clarion County. Like I said, I've got an office over in Venango County. We get a lot of people come down from Warren, over from Du Bois, St. Mary's. Unfortunately, a lot of areas don't have any physicians at all. There's no physicians in Forest County, Elk County, Cameron County that prescribe this at all. There's 1 physician in all of Jefferson County. I think there's 1 in all of Clearfield County, and the need far exceeds the availability. And most of the time, all the doctors are filled. At the present moment, we are filled. 4 of my doctors are only at 30 slots. We only have 820 slots. So, but Unfortunately, as I said, opioids are extremely addictive. I encourage people never to take a Vicodin or Percocet. They are identical to heroin. Any drug addict can tell you. They don't care if they get oxycodone, that's what's in Percocet, hydrocodone, or heroin. It's just they'll get whatever they can. They all affect the body the exact same way. The only difference between Vicodin, Percocet, and heroin is the farmers in Afghanistan don't put any Tylenol in with their heroin. That's the only difference. Do not ever allow any physician. There is nothing in the field of medicine where they are necessary. There is nothing in the field of medicine where they are the better pain reliever, but they are extremely addictive, and the addiction starts with the first dose. It's very sad to see the tragedy that's happening in our area. Virtually every month, I guarantee you, every month, I know of at least 3 to 4 deaths that are occurring in our area.
Every month?
Every month.
From heroin?
No, most of them are from pills and patches that doctors prescribe. They may or may not be prescribing them to that person, but fentanyl is a big killer, kills about 5,000 Americans a year. As I said, methadone kills 5,000. Methadone clinics hand that out, fortunately not in this area, but in other areas, and they're all for-profit organizations looking to expand. Oxycodone, including OxyContin, kills about 5,000 Americans a year. Heroin kills about 5,000. You're talking total deaths due to the opioid epidemic, including car crashes, murders, suicides, probably at least 30,000 Americans a year. And most of these people are young people in their 20s, 30s, 40s. They're not people in their 70s and 80s finally reaching the end of the line.
Do you or your other doctors ever prescribe Suboxone or Suboxone to people that aren't addicted to opiates?
No, I don't. There is a push by some manufacturers. They come out with a patch with the same medication in it to use it for pain relief. It is an inferior pain reliever, not as good as ibuprofen or naproxen, which are readily available over the counter. And there are a lot of anti-inflammatory pain relievers doctors can prescribe. Unfortunately, the pharmaceutical industry is keen on bringing out more and more narcotic pain relievers. It's a great profit stream for them because people become rapidly addicted and are on them for the rest of their lives. It makes a lot of money. The narcotic pharmaceutical pain industry in America, just for the pills, is $10 billion a year. And a lot of doctors are making a lot of money too. A lot of pain clinics are bogus. They're mainly pill mills. In the old days, 20, 30 years ago, pain clinics used to try to get people off of narcotics. Now it's quite the opposite.
Well, how do you combat that general image? Sometimes people say, oh, this Dr. X is just a pill doctor. How do you combat that image?
Well, too often they probably are just pill doctors. The big problem is that the regulations in our country were changed around 1990. Thanks to Purdue Pharmaceutical, the manufacturers of OxyContin, and the government made it much, much easier for doctors to prescribe narcotic pain pills. A lot of false information was put out by Purdue Pharmaceutical, and a lot of the doctors think that they have to give the narcotics to patients to adequately treat their pain. They don't know the research. I've got 500 studies at home, double-blind, random assignment, scientific studies done by medical schools around the world showing over and over and over again opioids are inferior pain relievers, and they are extremely dangerous, extremely addictive.
You mentioned earlier that you're one of the few doctors in the Clarion area that prescribe it. You mentioned some pretty small counties, but there are others. Why do you think other doctors basically won't touch this? Now, you are a psychiatrist. Do you have to be a psychiatrist to
No, any kind of physician can do it. I'm the only psychiatrist in this region that's involved with it, but I am a member of the American Academy of Addiction Psychiatry. Addiction medicine does appeal to psychiatry maybe more than some other specialties. But no, you don't have to be. A lot of physicians can't get into it because they're employees of big hospital complexes that don't want to get into addiction medicine. So that that makes it very hard for me to find doctors to help the people of our area, because there's only a handful of doctors that aren't part of those big hospital organizations, and a lot of times they have extremely busy practices of their own, outpatient family practices, and so it really makes it very hard to meet the need of the community. It's sad when I hear about the people dying, and I do my best to find ways to provide services to prevent that.
Is Suboxone covered by insurances?
Yes, most insurances will pay for it. Suboxone is very expensive. It's about $8 a pill. Subutex, which is a similar medication, it fortunately is a little less expensive. It's generic now. It's about $3 a pill. But both of them, so you're talking anywhere from $150 to $400 a month for the medication cost. Fortunately, most insurances, almost all insurances, will cover it. Most of the clinics don't take insurances to pay for the visits. A few do. They usually have a long waiting list. We take commercial insurances, but unfortunately Medicaid doesn't reimburse us quite enough to meet all of our costs, so we have to decline that.
So the pills are taken every day, one a day?
Yep.
Okay.
Most people start out with 2 milligrams, 2 pills, 16 milligrams a day. Some people can start out a little lower, but most people start out at that level, and then slowly decrease. Yes.
Now, in addition to the pills, you mentioned the work that you do with the people coming to your place, because if it isn't just a matter of the pills, then there's some type of other treatment involved, isn't there?
Well, we provide counseling along with that. Some people go to counseling programs in their own communities besides coming to us. Every county does have counseling programs for substance abuse, and we certainly encourage patients to take advantage of those programs. There are also a lot of online services available that have been shown in research to be helpful. It is very effective treatment. Unfortunately, some people do drop out and have a hard time getting away from the lifestyle. Most people want to get clean, do well, and are good patients. A few patients are not ready yet, and unfortunately sell our medication and do other things they shouldn't do, give a little bit bad name to the treatment, but it does. There is actually a research study from Massachusetts just came out within the past year showing that the death rate for people on Suboxone or Subutex therapy is 75% less than the death rate for people that are going to rehabs and detoxes to try to beat their problem, because those programs are much less successful, and of course when people relapse there's a danger of death.
How extensive is the counseling? I mean, how long do people come in to your office, say, or other doctors to talk with them, and the counseling? What do you do in the counseling, I guess, with that?
Focus on prevention strategies, ways to avoid relapse. There might be some family work involved. Build up support systems, and of course, a lot of the patients have a lot of pressures, a lot of stresses in their lives, unemployment, maybe some legal issues from before they got on Suboxone to deal with. A lot of them are on probation. Some of them have bad habits. I would say the clear majority of people with criminal orientations have become addicted to opioids as well, and so we have to help them try to change some of their old habits. The large majority of our patients, though, have no real criminal background. They may be committing crimes by when they get addicted to the pills the doctors are giving them, and then the doctors cut them off. They may start buying from their neighbors or others, but other than that, they have no criminal inclination whatsoever.
Now, is that individual counseling, or do you have group counseling?
Both, yes.
Both. So how much time a month does the average client spend in counseling?
Maybe just a couple hours. the treatment is really pretty good. And there's no good research showing that extensive, long-term, intensive psychotherapy is necessary to be successful. And a lot of the people that we see don't really have any basic psychiatric problems. They just got addicted to an extremely dangerous drug. Just like people that get addicted to cigarettes. They're not necessarily psychiatrically ill.
Well, thank you, Dr. Radecki. We're going to take a break right now and then rejoin Clarion Connection.
The Clarion Rotary Club is seeking donations for their annual Rotary Radio Auction. The auction will be held on Saturday, March 10th. Any new merchandise, goods, and services and cash donations will be accepted. All proceeds from the auctions go to local Rotary community projects. Promote your business by making a donation to the auction. All donors are promoted in the Clarion newspapers, this radio station, and your business will be part of hundreds of local businesses who make a positive difference in our community. Make sure you tune to this radio station on Saturday, March 12th at 8:30 a.m. for the annual Clarion Rotary Radio Auction. To set up your donation, contact C93 Radio 13 at 226-4500 or clarionradio@comcast.net or any Clarion Rotary member. The Clarion Rotary Radio Auction will be held Saturday, March 10, 2012 from 8:30 to 3:30 p.m.
Do your neighbors need help keeping warm this winter? You can help warm their homes and warm their hearts through National Fuel's Neighbor for Neighbor Heat Fund. This is Nancy Taylor from National Fuel with information about the Neighbor for Neighbor Heat Fund, a voluntary program that assists qualifying individuals who require some extra help meeting their basic energy needs. Since 1983, the fund has received more than $6 million in donations, and more than 300 households are helped each year. Your neighbor could be one of them. Donations to Neighbor for Neighbor help pay energy bills for those who need it most. Giving to the program is easy. You can make a single contribution or a monthly pledge on your National Fuel bill. The amount will be matched by the National Fuel Gas Company for your neighbors within National Fuel service territory. Warm homes and hearts through the Neighbor for Neighbor Heat Fund. To learn more, call 1-800-365-3234 or visit us on our website at www.nationalfuelgas.com.
Welcome back to Clarion Connection. I'm Ron Wilshire, and my guest today is Dr. Tom Radecki of Clarion, and we're talking about Suboxine. And I wanted to continue our discussion. You had mentioned in the first section that occasionally some clients or other people do end up selling their medicine, and I've noticed in the local newspaper that there have been some incidents reported, not necessarily from your practice or anything, but it seems like there is a street value to the drug now.
Oh yes, and I always ask my new patients, virtually 100% of new patients have already tried out Suboxone or Subutex before they come in to see me. They bought them on the street, and they find that they are helpful and helping them stop the vicious cycle of their addiction. And the higher the value, the more effective I think I'm being at keeping the pills off the market. Down in Pittsburgh, pills will sell for about $10 each. Up here, you're talking $20, $30 because they have a harder time finding them. But and a lot of people, they want to get away from their addiction, and they find that Suboxone and Subutex work very well, so they're willing to pay the money until they can find a doctor with an opening to come in and get their own supply.
Now, I know I ran for an office in the election last year, and I know particularly when issues were reported for the DA candidates, there seemed to be a lot of fear about Suboxone clinics and that operating in the area, attracting people that might cause problems later on in the area.
In fact, people coming to the Suboxone clinics primarily are people wanting to get clean, people trying to get clean. What I'd worry about is the people going to doctors' offices and getting the extremely powerful class 2 narcotics, the Percocets, the Vicodins, the Oxycontin, the Opanas. Those are the things that are being sold on the street too. Actually, it's far easier to find those and buy those, and I'm very concerned about how many doctors and emergency departments and surgeons are readily prescribing those, not practicing evidence-based medicine, because the evidence is that they are not necessary for pain relief. They are inferior, they should not be prescribed, and they are extremely addictive. And the only reason the laws got watered down back in the 1990s was money paid to politicians and bogus patient groups that were set up by Purdue Pharmaceutical, and now we are in the midst of a terrible opioid epidemic. It's really very disconcerting.
And you see your role as helping people get off opiates.
Yes, yes.
Now, how is if people are interested, like you said, is your an office like yours the first step, or is there more traditional treatment that they should go through?
There are traditional treatments. Because of the research showing a higher death rate from people using rehabs, and the success of detox is virtually 0%. Virtually 100% of people relapse within days or weeks of getting out of detoxes. I think the first step should be Suboxone or Subutex. It's the safest remedy. Unfortunately, of course, the most important thing to do is not become addicted in the first place. Do not get started with pain pills. They are extremely dangerous. So we see a lot of people. Actually, national research shows that high school students are more likely to experiment with narcotic pain pills than they are with marijuana now. It's really very frightening. You're talking about the most addictive, most dangerous substance known to the human race, virtually identical to heroin. Vicodin and Percocet are identical to heroin. I want to emphasize that, and nobody should experiment with those at any circumstance.
Well, where do you think the Suboxone that people are selling comes from in the area? It surely can't all come from your practice.
Well, once in a while it comes from my practice. I get new patients and I ask them, who they buy them from, and a lot of times patients will be honest and tell me. All of my patients, one of our rules is that they have to, they're on the honor system. They have to act in an honorable manner and not be enabling patients to abuse my system and continue drug abuse, and so they have to report that. And so some does come from my office. I'm happy that the majority of reports I get are not from my office. They're from people that get, some doctors, especially down in Pittsburgh, are prescribing higher numbers of pills, and so that the patients have extra pills to sell. And so a lot of times it's coming from Pittsburgh.
A lot of times, I mean, I have heard stories about even local schools. It's available for high school students or whatever, and even Philadelphia, it seems to be more regarded as even in the nature of candy or something. It's so prevalent.
Well, I doubt very much that it's as prevalent as Vicodin and Percocet. That's what my patients tell me. They say it's not that easy to find, at least in this area. Whereas Vicodin and Percocets, those are being popped in OxyContin. That's being done by high school students, young people in their 20s using those as a party drug. You don't really get very high on Suboxone. It's not a party drug. The large majority of people are taking it to get off of the highly addictive party drug type of medications.
Now, the Percocet and Vicodin, those primarily could come from family and relatives, raiding the medicine cabinet.
Yes, absolutely. Of course, they all come from doctors. And pharmacies. And so the amazing thing is a lot of pharmacies don't like Suboxone. They won't carry Suboxone or Subutex, but they hand out tons of Vicodin, Percocet, Opanas, OxyContin. Those are the top-selling drugs in America. It's not Suboxone that's the danger. It's not Suboxone that's killing people in this area. It is Vicodins, Percocets, fentanyls, Opanas, OxyContin. Those are drugs identical to heroin. They should be taken off the market. They are very dangerous.
Well, why won't the pharmacies stock Suboxone? What are their fears with it?
Well, obviously, anybody on Suboxone has become addicted to opioids, and they just jump to the conclusion that they are no good drug addicts. Of course, the drugs that they got addicted to were dispensed to the same or other patients. These are people who are trying to get away from their addictions, but a lot of pharmacists don't understand that the large majority of people on Suboxone and Subutex are doing their best to get away from addiction. They're not the people that we're concerned about. They're working to get away from it all.
In terms of methadone clinics, you would have to go there for the methadone. Is that correct?
Yes, methadone is an extremely dangerous drug, so people have to go in every day. The closest methadone clinics are about 60 miles away. Methadone has lots of side effects. It causes an average of 20 pounds weight gain, causes 62% of males to become partially or totally impotent because it knocks the heck out of your testosterone. And it's very easy to kill yourself with it. So that's why they make them go in. It's very hard to kill yourself with Suboxone or Subutex. So people can come in once every 4 weeks once they get stabilized, and they can have a job, they can have a life. With methadone, the large majority of people don't have jobs. They stay on welfare with the specific intent of being able to have the insurance to pay for their methadone clinic.
Thank you, Dr. Radecki. It's been a pleasure having you on the show today. I guess to summarize things, don't do drugs, people.
Give hugs, not drugs.
Give hugs, not drugs. And I want to thank everybody for listening to Clarion Connection, and we'll see you next week.